Welcome to the Deep Dive. Our mission, as always, is to take these complex topics, cut through all the noise, and really distill them into clear, actionable insights for you. Today, we're plunging into a pretty critical area, focusing on our equine friends. You know, even the fittest athletes, and horses are definitely up there, can face these hidden health problems, silent threats that can impact, well, not just their careers, but their actual lives. So today's deep dive is all about equine myocardial disease. This is fundamental stuff, really. It's about the health of their heart muscle. We've gone through your sources, pulled out the key info, and we're here to give you a solid understanding what it is, its causes, diagnosis, and what it all means for a horse. Think of it as your fast track to getting informed on this, with maybe a few surprises, too.
Absolutely. And we'll try to connect those dots for you, show how vital that heart function is and just how complex these conditions can be. It's really crucial to grasp.
Okay, so let's unpack this then. What exactly is equine myocardial disease? At its core, it's any condition that mainly affects myocardium. That's the heart muscle tissue itself.
Right. It's distinct from, say, problems with the heart valves or the sac around the heart, the pericardium. Those are different issues.
So the main problem here is that the heart muscle itself can't contract properly, can't pump blood effectively.
Exactly. When that happens, the heart pushes out less blood-reduced cardiac output, we call it.
Yeah.
You can get irregular heart rhythms, arrhythmias,
Mm.
and in really severe cases, it can unfortunately lead straight to heart failure. And what's really striking is how critical that muscle is, especially for horses, given their athleticism demands.
Yeah, incredible athletes.
Right. So when that myocardium is compromised, it hits their performance hard, but also just their general health. It's also worth noting there's a difference between focal and generalized disease. Focal is like a localized patch of damage.
Okay.
That often messes with the heart's electrical system, leading to those arrhythmias, the irregular beats. Generalized, though, means the whole muscle is weak. That leads to a big drop in systolic function, pumping power.
Right, the squeeze.
Yeah, exactly. The heart just can't push blood out effectively. And that means poor perfusion everywhere. Organs don't get enough blood.
So it's not just the heart. It affects, what, kidneys, other organs?
Kidneys, the GI tract, liver, even muscles. It becomes a systemic problem, really impacting the whole body.
Wow, that interconnectedness is key. Okay, so let's get into the causes, because it sounds like there isn't just one thing that triggers this. You mentioned the most common form is myocarditis, inflammation of the heart muscle.
That's right, yeah. Myocarditis is inflammation. And the causes are, well, they're really diverse.
Like what? What did the sources point to?
Well, first off, infectious causes. Things like viruses, equine influenza, equine herpes virus, even EIA virus.
Okay.
Bacteria too, streptococcus, salmonella, clostridium, even Lyme disease sometimes.
Lyme. Interesting.
Yeah. And parasites, like the larvae of Strongylis vulgaris migrating through tissues, often it's a systemic infection that just spreads to the heart.
So infections are a big one, but not the only one?
Not at all. Toxins are another major category. Horses might graze on plants they shouldn't.
Like what kind of plants?
Things like white snakeroot, oleander, yew, milkweed, foxglove, even avocado in some parts, they contain cardiotoxins.
Wow, common plants sometimes.
Exactly. Or chemical toxins, ionophores, for example. They're common in cattle feed, but highly toxic to horses. Monensin is a big one.
Right, I've heard about that danger.
And blister beetles in alfalfa hay, that can be devastating, causes severe myocardial necrosis.
Okay, so infections, toxins, what else?
Nutritional deficiencies can play a role too, especially severe lack of vitamin E or selenium.
Ah, white muscle disease.
Precisely. That affects muscle, including the heart muscle, particularly in young foals. Copper deficiency has also been implicated.
And sometimes you just don't know the cause.
Frustratingly, yes. Often it's classified as idiopathic. We just can't pinpoint the trigger despite a full workup.
Okay, so that's myocarditis. What about other types? You mentioned cardiomyopathy.
Right. Cardiomyopathy is more of a chronic disease of the heart muscle itself, making it harder to pump blood long term. There are different forms. Dilated cardiomyopathy is where the heart chambers get enlarged and the walls thin out, so the pump is weaker.
Less efficient.
Exactly. Then there's hypertrophic, where the walls get too thick, less common in horses than in, say, cats. And restrictive, where the walls are stiff and don't fill properly.
And the causes for those? Still sometimes unknown.
Often idiopathic, yes. Or it can develop as a long-term consequence, a sequela of a bad episode of myocarditis that wasn't fully resolved. Genetic links aren't as clear in horses as in other species.
Okay. And you also mentioned fibrosis, scar tissue.
Yes, myocardial fibrosis. That's scar tissue building up in the heart muscle, usually after some kind of injury or inflammation is healed. That scar tissue isn't functional muscle, so it can interfere with contraction and, importantly, disrupt the electrical pathways, leading to arrhythmias.
Makes sense. And the last one was degeneration or necrosis.
Right. Myocardial degeneration or necrosis. That's actual damage or death of the heart muscle cells, caused by many of the things we've talked about: toxins, those nutritional deficiencies, or severe ischemia, which is just a lack of blood supply to the heart muscle itself.
So a whole range of damage, from inflammation to scarring to cell death. The sources also mentioned a few less common things: fungal infections,
Yeah.
immune problems.
Yeah, less frequent, but still possible. Fungal myocarditis, immune-mediated diseases attacking the heart muscle, even cancers like lymphosarcoma or hemangiosarcoma infiltrating the heart.
And heart failure linked to things like MODS or SIRS, widespread inflammation.
Correct. When the whole body is under severe stress or inflammation, the heart can be secondarily affected, leading to myocardial failure. There were also mentions of things like amyloidosis, brain-heart syndrome, even rarely coronary artery issues, though that's not well documented in horses.
And specific plants again, like sycamore seeds.
Yes, that's a significant one. Grazing seeds from sycamore maples, or Acer pseudoprotanus or negundo, especially in autumn or spring, is linked to atypical myopathy, which severely affects muscles, including the heart. Marshmallow weed was another mentioned.
It really makes you think about their environment, doesn't it? Those subtle dangers.
It absolutely does. How much are we really aware of what they might be ingesting out in the pasture?
Okay, so knowing all these potential causes,
Yeah.
what are the actual signs? What should someone look for in their horse? I imagine it varies quite a bit.
It really does, from almost unnoticeable changes to, well, very severe illness. It generally reflects how much damage there is.
A classic one, especially for athletic horses, must be poor performance.
Definitely. Exercise intolerance or just poor performance. They might tire out way faster than normal, seem reluctant to work, or take ages to recover afterwards. That's often the first flag for performance horses.
What else? Just general lethargy?
Yes, lethargy or weakness, especially if it's acute or quite severe. Also, tachycardia, a resting heart rate that's higher than normal. The heart's trying to compensate, you see.
Right. And arrhythmias, you mentioned those are common.
Very common. Arrhythmias, irregular heart rhythms. Damaged muscle disrupts the electrical signals. You might see things like premature beats or sustained fast rhythms like ventricular tachycardia or atrial fibrillation.
Those can be really serious, right? Leading to poor performance or even...
Or even sudden death, unfortunately. Arrhythmias are a major factor there. You might also hear heart murmurs, sometimes secondary to valves not closing properly because the heart's changed shape. Or the heart sounds might seem muffled if there's widespread disease or fluid.
History matters too, I guess, like if they've collapsed before.
Absolutely. Any history of collapse, unexplained distress, episodes of fever, those are all really important clues for the vet.
And then things can get worse, leading to congestive heart failure. CHF.
That's the advanced stage, yes. Congestive heart failure. That's when the heart is really failing as a pump. Signs then become more obvious often. Pulmonary edema, fluid in the lungs. That causes coughing, faster breathing, difficulty breathing, what we call dyspnea.
You might hear crackles in the lungs.
You might, or see specific signs on ultrasound, like beelines. Then there's ventral edema, swelling under the belly and the brisket area, down the legs. Fluid accumulation.
Okay.
You might also see the jugular veins in the neck are distended, maybe even pulsating. That indicates high pressure backing up from the heart.
And long-term, weight loss.
Yes, in chronic cases, weight loss or cachexia. And worryingly, fainting or collapse syncope, especially during or just after exercise, if the heart just can't keep up output.
And the worst outcome, sudden death.
Yes. A tragic outcome, particularly in athletic horses, often linked back to those severe arrhythmias triggered by exertion.
Gosh, that's a daunting list. So diagnosis must be pretty involved. How do vets pin this down? Starts with the basics, I assume. History and exam.
Always. A really thorough history of performance changes, diet, potential toxin exposure, any previous illnesses, and a careful clinical exam listening closely to the heart and lungs, checking pulse quality, mucous membranes, looking for that edema.
Then you move on to more specific tests. ECG.
Exactly. Electrocardiography, ECG. A resting ECG gives you the baseline heart rate and rhythm. But for athletic horses, this is key, and exercising ECG is often needed.
Why is that?
Because many significant arrhythmias only show up during or right after intense exercise. They wouldn't be seen on a resting trace. So you use either wireless telemetry during riding or run them on a treadmill.
Ah, okay. Makes sense. What about arrhythmias that aren't constant?
For those intermittent ones, we use a Holter monitor. It's basically a portable ECG that records the heart's rhythm continuously for 24 hours, sometimes longer. Great for catching those sporadic episodes.
Okay, so ECG is crucial for rhythm. What about the heart muscle structure and function itself?
For that, echocardiography, cardiac ultrasound is really the gold standard. It gives us detailed pictures of the heart.
What can you see with that?
We can see the chambers, measure the wall thickness, watch the valves work. Crucially, we can assess how well the heart is pumping the systolic function, things like ejection fraction, and how well it's relaxing and filling the diastolic function.
So you can see if the chambers are enlarged or walls too thick, like in cardiomyopathy?
Precisely. And you can sometimes see focal areas of abnormal texture or movement suggesting damage or scarring. It helps differentiate myocardial disease from valve problems or pericardial disease.
Are there blood tests that help? Biomarkers.
Yes, cardiac biomarkers are very important. Cardiac troponin I, or CTNI, is a big one.
Troponin, isn't that used in humans for heart attacks?
Exactly the same principle. It's a protein released from damaged heart muscle cells. So elevated CTNI is a highly sensitive and specific sign of myocardial injury or necrosis, especially useful in acute situations.
Any others?
Natriuretic peptides like proBNP can also be helpful. Levels tend to rise when the heart is under strain or failing, so they indicate dysfunction and can track severity or response to treatment.
And general blood work.
Still essential. A complete blood count, CBC, can show inflammation or infection. Serum biochemistry checks electrolytes, kidney and liver function, which can be affected by poor perfusion, and muscle enzymes like CK and AST, though those are less specific to the heart.
And checking for those specific causes. Toxins, nutrition.
Definitely. Toxicology screens on blood, urine, or feed if exposure is suspected, testing vitamin E and selenium levels, and specific tests for infectious diseases like Lyme, EHV, influenza, depending on the clinical picture.
Are there even more specialized tests? Biopsies?
Occasionally, an endomyocardial biopsy might be considered. It's invasive, taking a tiny piece of heart muscle, usually via a catheter threaded through a vein. It carries risks, so it's not routine.
And postmortem.
Necropsy is invaluable, especially in cases of sudden death. It allows for a definitive diagnosis and characterization of the damage, which can sometimes help other horses in the same environment.
It's important to rule out other things too, right?
Absolutely. Differential diagnoses include primary valve disease, pericarditis, arrhythmias caused by electrolyte imbalances, or even severe skeletal muscle diseases that might cause weakness mistaken for heart issues.
Okay, that's a thorough diagnostic process. So let's say a horse is diagnosed. What happens next? What's the treatment? Must really depend on the cause and how bad it is.
Completely. Treatment is highly tailored. The first principle is if you know the underlying cause, treat that.
So antibiotics for bacterial infections.
Right. If it's bacterial myocarditis, appropriate antibiotics. Antivirals are limited for horses, unfortunately. If it's toxins, the absolute priority is remove the source, stop exposure. Then supportive care may be activated charcoal early on, IV fluids. Specific antidotes are very rare.
And nutritional issues.
Supplementation. Vitamin E, selenium, copper, whatever is deficient. That's straightforward, relatively speaking.
What about managing the heart problems themselves, the dysfunction?
That's the other major focus, and rest is paramount, non-negotiable. Strict stall rest initially, maybe for weeks or months, followed by a very slow, gradual return to any kind of work, carefully monitored.
Okay, rest is key. What about medications?
Several types might be used. Anti-inflammatory drugs, maybe corticosteroids briefly in some acute, non-infectious cases, though that's debated. NSA for pain or systemic inflammation. If there's congestive heart failure, diuretics like furosemide are crucial to get rid of the excess fluid causing edema.
Right, reduce the swelling.
Exactly. ACE inhibitors, like enalapril, help reduce the workload on the heart and manage the hormonal changes in heart failure. They make it easier for the heart to pump.
What about drugs to make the heart beat stronger?
Those are positive inotropes, like digoxin for long-term use or dobutamine in a critical care setting. They increase contractility but need careful use and monitoring, as they can also increase oxygen demand or risk of arrhythmias.
And drugs for the arrhythmias themselves.
Yes, antiarrhythmics. Quinidine is the classic one for atrial fibrillation in horses. For ventricular arrhythmias, drugs like lidocaine, usually IV for emergencies, sotalol, amiodarone, or procainamide might be used, depending on the specific type and severity.
And just general support.
Crucial. Supportive care like IV fluids is needed, making sure they're eating well, continuous monitoring, especially in the acute phase. It's often intensive care.
It sounds incredibly complex to manage.
Yeah.
Which brings us to the prognosis. What's the outlook for these horses? You said it's highly variable.
Highly variable. It really runs the gamut from an excellent chance of recovery to, sadly, a grave outlook.
What influences that prognosis most?
Several key things. The cause is a big one. Toxic exposures, especially things like ionophores, often carry a guarded to poor prognosis because the damage can be severe and irreversible. There's a high risk of sudden death later, too.
What about myocarditis if you treat it?
Acute myocarditis, if it's relatively mild and the cause is found and treated, might have a fair to good prognosis with enough rest. Idiopathic cases are often more guarded because the underlying process might continue.
And the extent of the damage.
Absolutely critical. The severity of the damage and dysfunction. High levels of troponin indicating lots of muscle death, or very poor pumping function, seen on echo low ejection fraction, those point to a poorer prognosis.
The arrhythmias matter too.
Definitely. The presence and type of arrhythmias. Some minor ones might not be a huge issue, but complex ventricular arrhythmias or atrial fibrillation that's hard to convert back to normal rhythm significantly worsen the prognosis for life, and especially for an athletic career. Risk of sudden death is higher.
And if they develop heart failure?
Yeah.
CHF.
That's generally a poor prognostic indicator. The development of congestive heart failure usually means life expectancy is reduced, and management often becomes focused on quality of life, palliative care.
How they respond to treatment must count too.
Yes, the response to treatment. If the inflammation resolves quickly, troponin levels come down, heart function improves on echo, that suggests a better outlook.
And finally, their job. Athletic goals.
That's a major consideration. Even if a horse survives and seems okay for pasture life, the athletic goals are often compromised. Many horses with significant myocardial disease will have their athletic careers ended or severely limited due to reduced capacity or the ongoing risk of arrhythmias or collapse.
It really underscores the need for quick action, doesn't it, given how subtle it can be at first?
Absolutely. Prompt veterinary attention, a thorough workup for any horse showing concerning signs, even just mild performance decline, it's critical. Early diagnosis and management can make a huge difference to the outcome.
Wow. Well, that was certainly a deep dive. It's really clear how complex and frankly varied these equine myocardial diseases are. Understanding the types, the signs, the diagnostics, it feels vital for anyone involved with horses.
It really does, and it leaves you thinking, doesn't it, about that interconnectedness. What can we take away from this about the links between overall health, nutrition, environment, and something as specific as cardiac function in these animals?
That's a great question to ponder. A lot to think about there. We hope this deep dive has helped you get a much clearer picture of this important condition. Definitely let us know what other areas you'd like us to tackle next time.